Welcome to another episode of WeDriveHealth podcast. I am JT with Dr. Nate.
Yes, thank you very much. I am CEO and founder of WeDriveHealth.
We didn't really ask you that this time.
Well, but I'm just going to mention it anyway.
I'm the CEO now.
Just in case people forgot, you know.
No, I'm kidding. No.
Yeah,
It's good. Talk that talk. So what do you know again?
Nothing. Apparently I'm nothing. I'm just Dr. Nate from WeDriveHealth. Hope all is well all.
No. So what I wanted to do, the last episode we talked about men's health and how you like to specialize in it. So I wanted to ask you some questions. I'm sure come up all the time, but maybe people who aren't able to come into the office would love to hear your comments. So what are the best ways to prevent heart disease at any age?
Yeah, that's a very common question. So I could tell you from experience working in a hospital that I've seen men in their 30s with heart attacks. I've seen men in their 40s, 50s. It doesn't really matter the age. I even had a 28-year-old who come in to the hospital with heart attacks. So first thing is to understand your family history. I think that is usually the number one thing. And really understanding, there's one particular question that we like to ask. We like to ask if anyone before the age of 50 had a heart attack or massive heart attack in the family. That increases your risk threefolds for having a heart attack as well. So that's something to be very mindful of. The second thing is to understand your habits, right? So what are we doing in terms of your eating habits? Are you eating drive-through, something every day? Are you eating late at night? How are you managing your stress? So all of these types of things are very important. So if you can manage your stress better, if you're eating at least 3 hours before you actually go to sleep, making sure that your heavy meals are not too heavy at nighttime. So all of these types of things, these are modifiable things that you yourself can do to decrease. And third, smoking and / drinking. I'm going to put drinking in there. So any type of drug use that I like to put in there. So nicotine usage, so the vaping pens, I know people I
see it everywhere now.
Everywhere. And people don't realize that when I say, hey, do you smoke? I don't actually ask that question so vaguely anymore. I'm asking, do you use any nicotine type products, including vaping? Usually that gets a lot of responses because vaping is a nicotine, and we actually think it's a little bit more dangerous than cigarettes because you're just puffing as you're going.
What about Mary Jane?
Mary Jane. So Mary Jane, Mary Jane, this guy. So overall, there's really no data to suggest that it will increase heart problems. However, it does show some correlation with potential increase in depression. And then in that regard, you probably will not engage in physical activity, which would then probably lead to a cardiovascular event. Yeah.
That makes sense. So if you're smoking weed, but you're using a cigar wrapper to smoke the weed, how does that impact?
So there's still some level of nicotine in it. So there's still some dangers in it. Probably not the same as when you actually smoke a cigarette by itself, per se. But yes, there are some dangers associated with it. So honestly, if I tell patients, listen, I'm going to be real with you. Listen, our patients are our age, right, and younger. Many of them, they smoke cigarettes. I mean, not even cigarettes, I should say, smoke marijuana, right? I usually say, listen, go to a dispensary. Usually, and the reason why I say that, it's because low quantities of what you're smoking in a dispensary will achieve the same amount of effect that you're trying to get without you kind of smoking like crazy to try to achieve that high effect. And dispensaries are actually high grade quality type products. Okay. So, if I'm going back and forth with the battle of, hey, should I smoke? Should I not smoke? At the end of the day, if you're going to do it in a very safe way, right? So that's really the advice that I would have.
Perfect. So I had like 3 questions and then something. So hormone replacement therapy for men.
Yeah.
Like, talk about that.
Yeah. So many guys come in, their penises are broken. All right.
Broken is such a strong word.
No, you gotta say it. You gotta say it like that. You gotta drop it on them because these guys come in like, help me, like what's going on, right? So usually what I'm saying is these men are coming in and they can't start their performance in the bedroom, right? Or they would start the performance but can't finish their performance,
maintain.
right? So those two are considered erectile dysfunction, or ED. And usually what happens is it could be a multitude of reasons. It could be performance anxiety related to anxiety. It could be high blood pressure that's masking in that regard. Someone put it perfectly that, don't forget, we have arteries in our hearts, and one of the arteries actually runs the same as in the penis. So if we're having some cardiovascular problems, the penis, tends to,
or vice versa. That's what he said at the men's summit. It was like Dr. Randy, right?
Dr. Randy from urology, shout out.
So he said that it's such a small artery, so that's almost a precursor that maybe in 5 years you might have a massive.
Correct.
So
yeah, so
that blew my mind.
That, I mean, even in the primary care world, we didn't even know to that extent that's how it's impacted. But we have seen the correlation time and time again, right? So when guys are coming in, first things first, we draw their testosterone levels, their free and total testosterone, right? So one of the testosterones tells you what your body's naturally producing without anything else from the outside world, which is considered free testosterone. Total testosterone means what your body's producing plus what am I putting into my body that modulates the testosterone levels, right? So estrogen-rich diets like fatty foods, technically that will lower your testosterone levels.
Fried foods and stuff.
Fried foods, exactly. So all of those types of measures. So and alcohol, we're now starting to see that some certain types of alcohols, they're not really clarifying which ones yet, but maybe darker alcohols tend to be more problematic than lighter.
Hennessy, fellas.
Yeah, Henny, I know some Henny poppies out here think that this is what it's looking like, but sometimes the manhood doesn't like it, So so hormone replacement therapy only becomes a discussion where we realize that your testosterone levels are low and you actually have symptoms of low testosterone. So it could be whether it's sexual performance issues, whether it's profound fatigue all the time. No matter what you're doing, you're always tired. And you're like, what can I do to combat that? The natural way to combat that is actually lifting heavy weights. Right? That's why guys, when they get into the gym, they're like, and they're all jacked up. That's that testosterone that's starting to release and starting to increase. But testosterone replacement therapy, while it's not for everyone, it is proven to be safe overall, as long as there's a protocol in place. I know people are terrified of testosterone replacement. It's actually very common now. You could do short-term protocols where only after maybe 6 to 8 weeks we could reevaluate your testosterone levels. Then after that, we can get you off the testosterone replacement, and then you do the rest of the work.
Got it.
Yeah.
So I know you mentioned labs, right?
Yeah.
Is there specific labs that you have to request? I know that for me, when I came to you, you said these are the labs that you need to get. So can you kind of go more into that just quickly? Yeah.
So I mean, overall, primary care, we're trained to just do the standard labs, right? I like to call it the standard 6. We do a CBC, CMP, thyroids. We do vitamin D level, and then we also do like lipids and cholesterol and diabetes numbers, A1C, right? So. However, and then unless a patient mentions it, then we just draw those 6. What I realize is that patients in general, the number one complaint that I get from all patients, men, women, is fatigue, just fatigue, right? For different reasons. So for men, once that's the case, whether you complain of it or not, I'm drawing a testosterone level. I just want to see what's going on. In addition to that, I like to check your prostate levels, because if you're starting to develop prostate disease, like BPH, which is enlarged prostate, that also will impact your testosterone levels. Of course. So those are the things that we're also looking at as well. We like to look at peptide numbers, something called insulin growth factor, because if later on someone wants to decide to start peptide therapy, we need to know what their baseline numbers are first.
Did you check mine?
I definitely did.
Oh, okay.
Yeah. I got you good to go, bro. Good to go whenever you're ready.
Okay, cool.
You might dabble a little into something light, right?
I'm getting about to turn 40 this year, bro.
It's a big milestone for you, kid.
Yeah. So I might need to tap into that.
We'll talk offline. Yeah.
All right, perfect. So I guess this is another question that comes up. Staying fit on a busy schedule, right? Healthy tips for the modern professional.
Yeah. So I got to tell you, we all struggle with this. I'm an evidence of that as well. I'm nowhere near my journey yet of how to kind of achieve that weight, the fitness that I'm looking for.
Right.
But overall, a couple of things we have to be intentional of. Time, right? Time it can be a barrier, but it also can help us in certain different types of ways. I am very, very mindful now that we have to use timers for everything, or at least paying attention to carving out time for certain things. So what I tell men, and this is the simplest thing that I do because I find it very hard for me to go to the gym. Secretly, I've always told you I'm intimidated by going to the gym, right? Like I go to the gym, everyone that's there, they're buff, everyone's fighting over like machines, and then you got a bench press, and then people are kind of secretly looking at how much you're benching, and you're like, I don't need all that heat, you know what I mean? Like, so usually what I tell guys is start at home, right?
Okay.
The easiest things you can literally do are push-ups, right? You start with your push-ups, that will start to give you some energy. Then you're going to say, you know what, maybe I'll do pull-ups. Get a pull-up bar from Amazon, right? A couple dollars, you just attach it to something.
Yeah.
Right, and just hold it somewhere. Do that. Go to the park. Like you said, you could do some level of workout at the park. You can start incorporating as part of your daily regimen without it being such an excessive burden, right? You don't need to actually drive to the gym, get your gym clothes. Like, you don't need to do all of that. Just do some things at home. There's a lot of YouTube videos out there that are very practical. Household items that we use that are heavy, that can be used as weights, right? So laundry detergents that are full, that could be your starting light up weights to kind of do some curls. There's so many things that you can kind of do and think outside the box with. So I always empower men 3 days a week, some level of physical activity. And then when you get to the point where you're ready, hop over to the gym, see what you're able to do.
Got it. All right. So another question is truth about supplements. Which ones really work? I don't know if this is in your wheelhouse, but I'll let you.
Yeah. So we're all even I am struggling to figure this out, right? Because supplements are not FDA approved. There's no studies that say, yo, if you take this, this will happen, right? So with supplements, that's really the case.
So what about we start with like the basic, right? So let's say like the multivitamins and stuff like that, and then we can kind of
like build from there, right? Like the multivitamins are great, right? Because they have high amounts of B complex, and B complex has been proven to help with every type of neurons and neurological function, cardiovascular function, energy, even thyroid regulation. All are very important when you get these vitamins. The problem is that we just don't like taking vitamins on a daily basis. That usually tends to be a challenge, right? And usually it takes time for those vitamins to build up in the system. Anything that you take orally, only about 50 or 60% of it goes to where it needs to go.
that low.
Low. I'm telling you. That bioavailability, we get clapped with that joint.
So that's why
the IV vitamins are, they're like, this should be the new standard, the new normal, right? Like, that's why.
You guys do IV at WeDriveHealth.
Oh, yeah.
Right?
We don't play. We get into that IV hydrations. The goal is that you pop in a line, you sit back, you relax, and we curate a cocktail, a customized, personalized cocktail for the patient. And that usually includes high amounts of B complex, B12, glutathione, which is a liver detoxification. So many other things that we're able to put in the IV bag that you're missing when you can't take your vitamins on a daily basis.
So let's say like if you're taking the multivitamins or whatever, like should you be taking like zinc or well, obviously it's winter time for us, right? So I know vitamin D is going to be an issue.
Absolutely. So vitamin D at baseline for many of us patients of color, we don't really do well with vitamin D all year round, but in the wintertime really becomes a challenge. And usually the first things that I tell men is that if you're starting to notice that your mood is severely impacted in the wintertime, we all kind of have some degree of seasonal affective disorder where when the sun goes down too early, the mood's not where we need it to go. But it's really because the vitamin D level is very low. So usually boosting that up is really the challenge. So adding vitamin D, adding zinc. Zinc helps us with immunity, right? So vitamin C with zinc really helps with immunity. But for men, it actually has a really additional impact on lean muscle mass. And that also helps with testosterone growth and testosterone increase. So adding zinc will also be very important as part of the cocktail.
Got it. All right. So prostate health, what every man should know about screenings and symptoms.
Yeah. Yo, fellas, we are terrified of prostate screenings, right? Like,
bro, you already know.
Yes, it's like, why? Why does that have to be the way? So I have good news.
Why does it have to be the way is the question?
Yeah, but I have good news. Like we've now rechange the protocol of how we check prostate. No longer are we doing that dreaded digital rectal exam, like even that the DRE that they train us to do. We don't stick the finger anywhere that we don't want to stick the finger anymore, right? So we're actually doing it in labs, but there are some rules to this that patients don't recognize. When you're getting your prostate levels checked, you actually have to abstain from sex 3 days before that level is drawn.
3 whole days.
3 whole days. So you got to tell wifey to back off you because you're about to have some lab drawn. You know, got to make sure that's good. But in reality, the thinking is that it can falsely elevate, the prostate levels. Right. So usually if any type of trauma, and sex is considered some level of trauma, that usually is considered to be mindful of that. But overall, the thinking is that by age 40 to 45, all men should be getting prostate levels checked, whether it's in the lab work or if it's the old school way of DRE, which is a digital rectal exam. Regardless of how it's done, usually labs are now preferred. It usually will indicate to you if you are running a risk of prostate cancer.
So is it one of those things where you get the labs done first, and then if it's, I don't want to say inconclusive, but then you need more, then you gotta go to that urology, and the urology does a fancier right? DRE. They do an ultrasound probe. So that's even worse.
It's tiny, so it's nothing bad, nothing crazy. But regardless, usually if the levels in the lab work is inconclusive, then we have to bump it up. And the reason why this is important, right? Like, why go through all of this? Prostate cancer is a very, very common type of cancer for men to develop, right? So it's one of the top 3 types of cancers. Lung cancer is the number 1 cancer for all male and female. But number 2 is prostate cancer for men. It's very curable too. And great news is that prostate cancer is actually slow-growing cancer, so people don't really die from prostate cancer per se. However, there's prostate cancers that are certain types that are very aggressive. And that's the scary part. So the aggressive ones, they can clap you at 40 years old. They can clap you at 80 years old. It doesn't matter the age. So we don't want to be so young and then getting debilitated with a cancer that could be curable, right? So that's fairly reason why that we should all be getting checked out.
Got it. So last question. Optimizing nutrition, the best diets for men's health.
Yeah. So this is a common question that we usually get. Y'all got to get rid of these fatty foods. Like these fatty foods is killing us in so many different ways.
Dude, the Instagram be popping.
I know, right? Exactly. You just be scrolling through that joint.
Save.
Yeah. But let me tell you, the problem is you've created a crazy algorithm on your Instagram now, right? Yeah. Why won't you need to be following, or all of us should be better at following these nutritional buffs, right? That are like, yo, here's how to get high protein, good quality like foods, right?
Okay, I hear that.
Yeah.
And then their next line is, "I don't eat for taste." What?
Yeah,
bro,
I get that.
Delete.
Delete. Yeah, no, it's true.
I'm not listening to anything that you have to say after that. I don't eat for taste.
Yeah, no. So I mean, I think ultimately, some other secrets though, right? So you're gonna eat. You got to eat in moderation. Our portion sizes are ridiculous. That's also a challenge.
Well, that's a American thing.
That's an American thing. And I think, and then the time of day that we're eating our meals, right? Our heavy meals, we're doing it really badly. It's at night.
Yeah, I used to work at night, so trust me, I know.
Yeah, we get clapped. Like you're sleeping after you eat that heavy meal. You feel very exhausted, wiped out, and you have low energy, right? So the thinking is that your heavier meals should be in the daytime, up until lunch, and then by dinner time we should start tapering down. So those are very important things to keep in mind. And the last thing I want to mention about diet is there's new research right now that shows us that the sequence of how we eat the foods in our plate makes a difference. So eating the protein first and then eating the carbs last. So that's just something to keep in mind.
I've never even heard that before.
Yeah. So more to come on that because there's more research about that.
Let's discuss that next episode.
Yeah.
So thank you for another episode of We Drive Health, or as we call Ask Dr. Nate. That's what we call the segment, right?
Yeah.
Ask Dr. Nate.
Yeah, this one we'll say Ask Dr. Nate. I appreciate it.
All right.
Yeah.
Any final words?
No, that's it. Let's continue to optimize our health. Men, ladies, everyone, let's do it. Until next time.
Live long and prosper.
There we go.